So today we are going to talk about an important disease, very important disease, that is TB, tuberculosis. What is the full form of TB? It is nothing but tuberculosis. Okay. So what is TB? So basically, it is a disease which is caused by bacteria. Okay. So we have different types of pathogens like bacteria, virus, uh, other fungal, so infecting things which can damage our organs. So in that, the bacteria which affect the body, okay, that is Mycobacterium tuberculosis. Mycobacterium tuberculosis. This is the name of the bacteria. Okay, so mostly this bacteria will attack the lungs. Okay, mostly 80 to 90%. But sometimes it will also affect the other than lungs, kidney. Kidney also affected with bacteria. Spine also may be affected with the bacteria. Brain will also affected with the bacteria. Okay, so which bacteria? Mycobacterium tuberculosis. So basically, it will be preventable and it will be treatable. Okay. And something we want to know that everyone who is affected with TB will not become sick. Okay, sometimes they will have the symptoms and the symptoms can be treated. Uh, with the simple treatment, the symptom will go on. Because of their high immunity, the patient will not have that bacteria. Okay. So, but one thing we have to remember that if the TB is not treated, it may be fatal. It may be take the life of the person. Okay, this is very important. And it, so you can see that this data in 2022, 2.42 million, minimum 24 lakhs is affected. In 2021, 21 lakhs, 21 lakh 18 lakh persons are affected with TB means the graph is increasing, it is not decreasing. So number of people affecting with uh, TB is increasing in day by day. Yeah, because of the hygienic conditions. Okay, due to about air or waste material. Okay, dumping yard, everything is responsible. Okay, so how the TB spreads? If a person is affected with TB, if he cough, if he sneeze, if he speaks, or if he sings, the droplets from his mouth will enter into the air. From that air, it will reach to the person who is suffering with TB. Or the person is living with a TB person, okay, who has affected with TB and diagnosed, he is taking treatment. Okay, so this is what we have to remember. But one thing is initially, who is suffered started with TB infection, there are higher chances the infection is cannot be spread. It was after entering to the body level, right? After diagnosis, then have the chances to spread into the air environment. But we have to remember TB is not spread by brushing, sharing brush. I don't know any saliva, shaking hands is okay. Touching bed, okay. Using toilets, okay. Sharing food, it is also okay. But air droplets, whatever air droplets or the droplets which is coming from the lungs, they are responsible for spreading of TB. So we have TB infection, TB disease means initial TB infection and diagnosis after TB. What are the things we have to remember? Patient have small amount of TB infection, but they are inactive. If that person doesn't have symptoms and he doesn't feel sick, and high chances of not spreading TB infection. Okay, and the negative, okay, tests are negative, chest checks are normal, sputum test is normal. Okay, so what we will give the treatment for not spreading in the body. Okay, but the person is suffered with TB and diagnosed. What are the symptoms? A cough more than 3 weeks, chest pain, okay, cough with blood and sputum, weakness, fatigue, weight loss, and loss of appetite, chills, fever, night sweats. All these are the symptoms of TB. Weight loss, we can see cough, fever, fatigue, okay, and weakness, weight loss, coughing with sputum, chest pain. I always feel sick. Okay, and chances of spreading TB to the other person are high. Okay, then whenever they get a blood test, it will be positive and they need treatment. Okay. What are the risk factors? Okay. The person who is suffering from homeless condition without shelter, they have the chances of getting TB, low immunity, or traveling to the TB areas, any substance using. Okay, with living with person who is affected with TB, have the risk. So, what are the blood tests we have to do? Okay, in the TB, we have the blood test and skin test and X-ray. First, initially, we have the blood test. That is non-tax tuberculin skin test. This is done by the healthcare provider. And we have chest X-ray. Okay, and we have sputum test. What is the sputum coming from the lungs? We have to do the culture and sputum test, X-ray, okay, which will give the clear idea about the presence of TB in the lungs. Okay, these are the test. And sometimes the BCG vaccine is given in the initial stage for the baby. Okay, because some countries have TB is common. In India also BCG vaccine is given to the children. Even though some person will affect with TB, even though they taken BCG vaccine. Okay, but it is not rarely used in United States. So, what type of treatment you will take? You have the uh, you have the drugs which are available in the market. Government also making uh, free distribution of drugs, and they are doing some amount to purchase the medicines and immediate things. We have TB schemes also, TB affected schemes in the stream in India. So we'll get the treatment for that. So we have some drugs. There are the number of drugs in the TB treatment. We have to know that. That in that we have group 1, group 2, group 3. In that we have the first line of drug, second line of drug, isoniazid, rifampicin, ethambutol, pyrazimide, oxyfloxacin, levofloxacin, okay, linezolid, dilamanide, bedaquiline, okay, and many more. Okay. The number of drugs are coming nowadays. And you want to know one thing about that is some drugs will not work. Some drugs or multiple drugs cannot work. We will call it drug resistant TB. Drug resistance TB is very dangerous because no drug is working for the patient. So we need some other type of treatment, and person who is very uh, or higher level of treatment can be given. So, but you can read in electrochemical. What are the drugs? You can advise the patient that you will get the proper treatment. So here, infection, depending upon the infection, chronic or acute or severe, you need to select the drugs. So we have, if the is a chronic condition, you need to take GE also. If it is acute, along with G, you need to be okay. First drug, which is very important, P2, C5, and G. So you know the drug can give in mostly D4 because the quantum level energy is decreased and the patient will need to give more quantum energy medicine. Next is P1B, next C17, G, okay, and in advice ointment or make just apply of P1 or P2, C13, B, then ointment or application apply. And I always prefer a nebulization if possible, but if they have chronic okay, sputum is coming high amount, you can advise this remedy for nebulization policy. P1 and P3, okay, C17, F1, G or B. So these are the remedies you can advise the patient. Okay. So you will get, if the patient have not having appetite, low appetite, you can as well as S1 before food, S10 after food, or S1, S1 RE before food, S10 CTMW after food. Okay, you can advise. And if the patient have constipation, you can advise S10 or C10 as last, S10, C10 as last, or even single remedy as last and P4. Okay, and you can give application to the patient for better result. And you have to take protein diet, high protein diet because of weight loss, to improve the to gain the weight. You have to take highly protein diet. So this is all about eating.
बरोबर आहे. बेटा खर्चा होता
So you can see
Huh?
this is the problem. This is the non-excellent. So this is all about tuberculosis in the